is back in session, and while you're worried about getting the kiddos geared up for back to school, it's important that we include their smile too. Here to fill us in on how A+ Dental can help take care of your kids' teeth just in time for the school year is Dr. Tim Herdman. Welcome, Tim. How are you?
I'm great, thank you. Well, thanks for having me.
Well, we were just talking about going back to school, and why is this a good time to get the kids' teeth checked out?
You know, it's really important that we get our kids to school so that they can learn, and we don't want them distracted. So if their teeth are bothering them, if they have a toothache, that can be really distracting and they may not know exactly what it is. So I think it's a good time to get them checked up to make sure there isn't any problems so that when they get to school, they can be engaged and learn and have fun.
And I think it's important because, right, you just want to make sure their health is all included and checked out, and that includes, you know, their teeth and taking care of hygiene in the mouth.
You know, teaching them how to keep the teeth clean and really checking out to see, you know, if there's a problem, we can get it fixed before school starts and get them taken care of.
Well, why should parents consider a place like A+ Dental Care as somewhere they can go to get that done?
You know, we've got 6 locations currently. One in Midtown Sacramento, one in Folsom, 2 in Roseville, 1 in Rockland, 1 in Lincoln, and soon to be 1 in North Natomas. With terrific dentists, we've got specialists. It's a whole team approach that really can take care of your kids and the whole family. And we have hours that are open before school and work and after and on the weekends. So we can get your whole family in. If you don't want to get your kids out of school, bring them in on Saturdays. We can get them taken care of and then off to soccer games or off to baseball games or whatever the other family wants to do.
That's right. We're always juggling multiple schedules. When you see a new child or a person comes in, what are some of the things that they should be doing already when you do their exam? What are some of the things you like to look for?
So starting out with the youngest children, we shouldn't be putting them to bed with bottles, right? We should make sure that they're not going to bed with any milk or juice on their teeth. But as they get to be older, parents should be brushing their teeth. I'm a strong believer that parents should brush their kids' teeth up till age 7 or 8 to make sure that they're nice and clean, and then get them nice and, so brushing, flossing, once they start getting their permanent teeth in, the teeth are generally close enough together. We need to make sure they're flossing. Baby teeth are real soft, so we want to make sure they're really clean.
How do we get them excited about brushing and flossing? I know last night I was actually pleased. My 6-year-old had a whole spread. He has his floss out, he had his mouthwash and his toothbrush with his toothpaste ready to go. That was the first time. He took it upon himself, but how do we get them excited? You
know, I think one of the things I really recommend doing for our parents is really to start early, is lay the kids down in your lap and brush your teeth just with water, get them all nice and clean. Then you can let them stand up, because when they're down in your lap, it's like when patients are down in our lap in our office and we have really good visibility. We can see what's going on. You can see that you've got all their teeth cleaned. You can see if you have problems. And then you can let them stand up, and whether it's a special flavor of toothpaste that they like, whether it's a mouthwash they like, you know, a brush, get them a timer so that they're brushing long enough. All of those things, a little, you know, egg timer, 3-minute egg timer, just to make sure that they're in there doing it. Let them stand around, listen to music, whatever it is, to really make them so it's a fun thing, and that they're doing it.
Yes, it needs to be a happy activity. What about when it comes to orthodontics? When should we start thinking about braces, Invisalign, and bring them in for a checkup?
So the American Orthodontic Association recommends that all children be screened for orthodontic needs at age 7.
Okay.
And so in our practice, we make sure that we will get what's called a panoramic x-ray, so we can see all the teeth that are coming in. You know, so we'll end up seeing all the baby teeth, seeing all the permanent teeth that are coming in, if they're coming in the right place, or if there's early needs that are going to be, or if they have enough space and it's like, okay, this is going to be great. You know, maybe when you get all your teeth in, you're going to need something straightened, but it's really at age 7, so we can check, because they usually have their permanent first molars in, their 4 incisors upper and lower, and we can start seeing where the rest of the teeth are going to come in.
Right, getting them ready for that adult smile.
Yes.
And what about sealants for cavities? Because sometimes that is a problem.
I'm a huge proponent of sealants, and I believe we ought to seal every posterior tooth, every nook and cranny, every groove. My daughter's 31. I sealed all her teeth, and she is cavity free.
Awesome.
And you know, so if we get sealants placed well, they're virtually 100% successful in preventing cavities in those areas where we put sealants. So insurance companies usually will pay for sealants on molars up through age 14. In our office, if you come in and we do sealants on your molars, on your children, if your insurance doesn't pay for them, we will, because they're that important.
Right.
Yeah.
Well, so if they do have a cavity, what do you recommend?
We generally are doing tooth-colored fillings now. We're not using a lot of silver any longer. You know, most of the time in baby teeth, we can do that. In some of our offices, we have lasers, so we can do it without even getting the patients numb.
Wow.
Without a drill.
So
the laser can do that. If there are big cavities, We can do crowns. Rarely do we do crowns on children. It's usually fillings. And again, we try to get it as early as possible so those fillings are as small as possible.
Right. Well, you gotta brush and floss. That's key.
Brush and floss.
Now, you have a special offer for our viewers.
We do. For our office to come in for a crown, crowns are fairly expensive, about $1,300. So for the first 20 callers, we're going to give you $300 off a new crown.
Wow. All right. And if someone wants to get in touch, find out more information, where can they go?
The best place to do is go to our website at aplusdentalcaregroup.com and pick the location that's closest to you, and our doctors and staff will take great care of you.
All right, Tim from A+ Dental Care, thanks so much for coming in and leaving us with some knowledge about getting our smiles ready for back to school.
You're welcome. Thank you for having me.
This interview involves commercial content. The products and services featured appear as paid advertising.